Oklahoma City, the great KTOK country, a cardiologist. How are you, sir?
I'm doing fine, Mark. Thanks for taking my call. I was just going to follow up a little bit on Dr. Chris. Unfortunately, the meaningful use concept that he was talking about is also already happening in the outpatient settings. The government basically is bribing doctors to implement pre-specified electronic medical records to collect data. And that is already happening, not just in the hospitals, but also in the offices once things go live in 2014.
Oh, now, wait a minute. Hold on now. Why do they need that information from a doctor's office? For the same reason, to keep pushing people into the kind of insurance they want them to have?
To collect data so that they know when to start treatments, and to create data pools so that they have a better idea as far as how to control what healthcare delivery is recommended or is consumed.
Doctor, do you see a day when you're going to have to get approval from the federal government before you have a procedure?
I see a day very soon where I work on a cash and barter basis only, and don't subscribe to any of the entitlement programs.
Because you got to get around it.
Right. That's going to be the only way to get around it.
But what about the patient? The patient goes to the doctor that you feel who hasn't gone to cash and barter, and they gather this information. I mean, I'm telling you, I can see the federal government at some point making decisions. Well, we're paying for it. We'll decide. Don't hang up yet, doctor. I want to pursue this with you. Well, yeah, we'll decide whether you get knee replacement or hip replacement or anything else. Of course, that's why they're gathering it. So they're already gathering this information, the federal government, correct?
The system's being put in place to gather the information. You're familiar with the Dewey Decimal System, obviously. The ICD-9, ICD-10 coding system that Dr. Chris was talking about is basically the Dewey Decimal System for medical diagnostic codes. The ICD-10 coding system adds 2 orders of magnitude increase in the number of diagnostic codes to that system. And get this, the level of coding is so detailed that if you come into the emergency room or come into a doctor's office with a sprained ankle, we have to code the specific reason, and there are numbers attached to a skateboard, a wakeboard, a water ski, a bicycle, any kind of injury.
Oh, my God. You know what they're going to do with this information? They're going to regulate the economy. They're going to regulate the care. They're going to... when they're not just gathering this information because they have nothing to do.
It has... No, that information has nothing to do with treating a medical problem. That information has to do with the Leviathan wanting to know everything about everybody at all times.
It's just beyond belief to me what we've become here, and that this has been sold as for the people, improving healthcare. By the way, how does this, in any respect, you're a doctor, cardiologist, how will this improve your practice, your treatment of patients?
Oh, it's substantially degraded patient practices or patient care already. What is also currently happening is a little system that Medicare uses called a RAC audit, where basically Medicare, under the auspices of Medicare fraud, presumes all physicians and all hospitals are fraudulent and guilty until proven otherwise. A lot of small community hospitals around the country are going bankrupt this year and will continue to go bankrupt in the next couple of years because Medicare is issuing these audits where basically these hospitals have to pay back money if they didn't dot the I, cross the T perfectly, and it
so basically, this isn't fraud. The federal government's looking for ways to get more money.
No, the federal government is looking for ways to consolidate care.
Mm-hmm.
A few years ago, they substantially reduced reimbursement to physician offices and increased reimbursements to hospitals. So most private practices, about 80 to 90% of private specialty practices, are now owned by hospitals. So they've driven physicians out of the business of medicine, and now they're going to drive the small community hospitals out of the business of medicine as well. So as Chris said, they can regulate care and control care in a more consolidated manner.
Mm-hmm. All right, Doctor Dwayne, thank you. It's not getting any better, ladies and gentlemen, is it?